We're appreciative that he did that. There's probably more that we would like to see happen, and we're going to continue talking to the governor's office. But at this point, we're in crunch time. I'm appreciative that he recognized that if we stayed on our current trajectory, our hospitals are overwhelmed early to mid-July. This is the time when my community now really needs to come together and be just religious about wearing face coverings and doing the social distancing.
You're obviously a blue mayor in a red state or a red governor. How has that helped or hurt the effort here? How has that challenged? I mean, it has unfortunately become a political issue in this country.
And it's horrible that something that is just pure public health would become a political issue. But following the lead of what's happening with the president in Washington, it's happening. I have too many people in my community working off of what's happening with the president that don't think that this virus is real, that don't appreciate the importance of wearing face coverings. And my governor then opened up our economy and did it too quickly and did it in phases, but didn't analyze what the numbers were in between moving from one phase to the next phase to see what would happen. And the messaging has not been as strong as it needs to be throughout this process, that you can't open the economy without the quid pro quo, without the community also being just vigilant with respect to wearing face coverings and social distancing. And that lack of connection, I think, is one of the key reasons why we're in the situation we're in right now.
I know you've been pushing for masks. What else have you been doing, Mayor Adler, to prepare? I mean, unlike New York, you've had months now to at least help get hospitals in the right shape and contact tracing and everything else that could help us fight this. How have you used that time?
We're in a lot better position than we were back in March, and I think New York and some of the other cities, we're in a much better position with the personal protective equipment and the supplies. Real importantly, we now understand the virus better, and the hospital stays has been reduced from what it was in New York. But we've been able to model the virus. We've been able to take the experience we had in shutting it down in March and April so that we can model now. We have a pretty good idea of what our triggers are when we're going to have to return to a shelter in place. If our city is not able to change its behavior sufficiently, we have a better indication of when our triggers are that we're going to have to pull the string on that. This is information we did not have 3 months ago when we didn't understand the virus.
What are you telling businesses right now about whether they should close their doors, whether they should make their customers wear masks? I mean, so much of it is on their shoulders now without any kind of federal policies.
It is on their shoulders, and quite frankly, I wish my governor was just making it mandatory that everybody in the state had to wear a mask whenever they were around other people. We had that order. It was mandatory. People started wearing the mask. The governor took that away from us. We now have it back a little bit, but it's only through businesses, which means we're not covering people who are not in businesses. But we have a lot of support from the business community right now because they, more than anybody else, understand that if people are not wearing masks, if people are not changing their behaviors, then the businesses are going to lose the opportunity to be able to stay open. So our Chamber of Commerce just released a wonderful campaign about being a city of us. And pushing for people to wear masks. We're getting a lot of support. We were asked by many of our businesses to try to get back to a mandatory mask situation. They understand the importance. Really, our biggest obstacle at this point is the messaging coming out of Washington, D.C.